Hi, my name is Maggie. I'm with speech therapy, and I just wanted to come in and talk to you a little bit about what we are going to be looking for in your son's swallow evaluation. Um, it's important that we are familiar with what a typical scenario of swallowing would be with a 4-month-old in order for us to see what could possibly be wrong. So I just wanted to talk to you a little bit about what we would see in a typical scenario of a 4-month-old swallowing. So 3 systems that we would look at. There's the oral system, which is basically just, everything in your mouth and your pharynx that is going into the swallow, so the anatomy. And basically it's very similar to yours or mine. It's just smaller because it's a smaller area, obviously. Um, so there might be a little bit more room for air there since everything is kind of right on top of each other, and the tongue is much bigger in a baby's mouth than it comparatively to what it is in our mouth. So just like they're chewing, and they also obviously don't have teeth yet, so all of those things kind of play a role into how it's different from what our anatomy is. Then also we're looking at the respiratory system. You probably noticed that your son's breathing rate is a bit faster than ours is, and that is because they are working harder to get oxygen, into their heart and into their body. So they're just working a little bit harder. And also babies are nose breathers. So if anything is impeding that nasal passageway, that can kind of interrupt with what's called a suck, swallow, breathe pattern that babies are following. And then we also look at the GI system. So their digestive system, how things are, if they have any reflux issues, anything like that. There are 4 phases to a swallow, and the first phase, which is oral prep, we don't necessarily look at in babies because that is, how the food is being presented to their mouth. And since babies are breastfed or bottle fed, that's not necessarily something that we need to worry about with your son today. But the oral phase is the first phase we'll look at with him, and just seeing if he can control his tongue when he's sucking from a bottle or from the breast. Does he have an adequate suck, swallow, breathe pattern? Is he, able to follow that pattern? Is he breathing more than he's swallowing? And if that rhythm gets off, it can cause milk to go down the wrong pipe for him to aspirate, and then that becomes dangerous. So just being aware of that pattern, making sure that it is going smoothly. The next phase is the pharyngeal phase, and that's when milk goes to the back of the tongue and it triggers a swallow. In that phase, your epiglottis and your vocal cords are what keep the food from going into the airway. The back of your tongue kind of closes off that entrance into the pharynx so that milk is not coming back up to the oral cavity. And then there's something called the soft palate, which is the very top back of the roof of your mouth, and that closes off your nasal passageway so that milk is not going up out of their nose. So there's a lot of very intricate parts of the swallow that we look at. And lastly, the esophageal phase is when the milk is going down the esophagus into the stomach, and we're looking at the muscles of the esophagus, making sure that they're bringing the milk down adequately and that the milk is going into the stomach and not coming back up, like acid reflux or something like that. So we're looking at all of those parts of the mouth today in the evaluation. So as far as the swallowing development of your son, they're constantly changing. They're learning and developing a lot in this time frame. So right now, what the milestones that he should be reaching right now are that he's rooting effectively. So, moving his mouth to where the food source is, whether that's the bottle or the breast. Sucking and swallowing is something he should be doing efficiently. He should be extending his tongue beyond his lips, and if he's not able to do that, sometimes that can show possible tongue or lip tie. He should be able to close his lips to seal the mouth, move his tongue in and out easily, and draw in his lower lip. And then, like I said, in the next year or so, he's going to continue to develop more and more. When he starts to sit up on his own, he will start having trials of food. First, pureed foods, and then food that he can chew later on down the road, and just seeing how he is able to, how his chewing movements change from not really chewing at all to kind of munching to the rotary chew that we use in our mouths. And you'll start seeing him controlling his sucking impulses and accepting a spoon whenever you do start purees. And then eventually down the road, he will start spoon feeding himself and turning his head towards where the spoon is, and just being more aware in general of food entering his mouth. He will start to suck from a cup and then drink from a cup eventually, and understand like the spoon function, what it's for, things like that. So obviously once they start getting teeth, their chewing will start to become more and more like yours and mine as well. So those are all things that you can be expecting in the next year or so. And then nutrition is so crucial for babies at your son's age. In the first 2 years of life, our nervous systems are developing, and our nervous systems control everything about us. So if a baby is now malnourished or not getting exactly what they are needing at that age, sometimes it can be hard for the child to catch up developmentally. So those areas, when I say developmentally, those areas would include like cognitive function, motor skills, and language skills. All those things, or some of those things, can be compromised whenever a child is not receiving adequate nutrition. And at a 4-month-old, at your son's age, we expect that he is eating every 2 to 4 hours, either breast milk or formula. He's getting about 8 to 12 feedings in a 24-hour period, and that feeding sessions would only last about 15 to 20 minutes. I'm sure you're familiar with cluster feeding by this point in parenthood, but cluster feeding is basically happening during large periods of growth, and when they are just needing more and more food, and maybe eating more frequently than they were before. So those are all kind of the areas that we'll be looking at today and assessing. So if you have any questions, don't hesitate to ask.